Hello, I'm Dr. Malescu, and today we will do a small little short lesson, 15 minutes, perhaps maybe a bit longer since I have a lot to say. The hypothalamic pituitary axis is what we will go over today. So I do hope you enjoy this video presentation. It literally is only 4 slides, but I have a lot to say in these 4 slides explaining the structure of the hypothalamus, the pituitary gland, and the hormones that they release. All right, so let's get started. Let's look at the relationship between the hypothalamus, which turns on the pituitary gland. So the hypothalamus is basically the control center for the endocrine system, and the pituitary gland, anterior and posterior, is an extension just below the hypothalamus, which is connected via this structure called the infundibulum. Now, the anterior pituitary is a strict endocrine gland because it is not related, it has no neural tissue like the posterior pituitary, which is connected to the neural tissue of the hypothalamus. Therefore, we call the posterior pituitary the neurohypophysis, and the anterior pituitary is called the adenohypophysis. Here we go. Okay, so now that we got that straightened out, the pituitary gland, as you can see, is divided into an anterior, so it's physically located more anterior. So the anterior pituitary and the posterior pituitary. So in this image, we got to see that the posterior pituitary is really going to be a direct connection and link with the hypothalamus. And both act differently, and the posterior hypothalamus, like I said, it has neural tissue that extends into the posterior pituitary from the hypothalamus, okay? Anyway, moving on, the hypothalamus has neural tissue, so I'm going to go over that in like a minute right here. So you can see this neural tissue. Now I'm going to describe to you what this neural tissue is. We have neural tissue that is basically nuclei, which are clusters of neurons that are present there. And these clusters of neurons have a different function. So the super optic nucleus is where the antidiuretic hormone is produced. This is one of the hormones that is produced in the hypothalamus, but stored and released in the posterior pituitary. And then the other set of nuclei or clusters of neurons that are part of the central nervous system, which, side note, central nervous system is brain and spinal cord, and as we know, the hypothalamus is part of that, part of the CNS. So anyway, the oxytocin is produced in the paraventricular nuclei. So we have paraventricular nuclei that release, that produce the oxytocin, move down the axons, the nerves, and communicate with the circulation. And so, therefore, the hormones can be released systemically into the bloodstream to have an effect elsewhere. So, oxytocin is, like I said, the hormone that is produced by the paraventricular nucleus, and the super optic nuclei over here is where the antidiuretic hormone is produced. And so both of these two hormones are basically going to be stored and released in the posterior pituitary. Very different than the anterior pituitary, which strictly synthesizes and releases. So it makes and releases the hormones in accordance with the dictation from the messages, I should say, from the hypothalamic hormones to, release. So this is purely an endocrine, and then this is related to the nervous system. So how is it related to the nervous system? Let's pretty much review that in a little bit of a few words here. So, like I said, the hypothalamus is neural tissue, part of the brain, which means the posterior pituitary is also neural tissue. And it extends and communicates, as you can see here, via the infundibulum. So this neural tissue extends all the way to the posterior pituitary via the nerves, okay? If we look at the anterior pituitary gland, it is not an extension of the hypothalamus. It is a true endocrine gland, which means there are no neurons here. That's why we call this, as you can see from here, neurohypophysis with the posterior pituitary, okay? So this is called the hypophyseal portal system in terms of importance. It is huge because it is an exception to what the anterior pituitary gland does. It is completely reliant upon the external environment, the environment to stress. The hypothalamus responds to that stress, okay? And like I said, ADH and oxytocin is going to be released and sends the signals, you know, via these nerves. And then, of course, as you know, the posterior pituitary is going to store the oxytocin and the ADH and be released whenever it is necessary. All right. So I think I beat that to the ground. Hopefully you understand that. So before we move on to the anterior pituitary, remember, the hypothalamic neurons make either ADH or oxytocin, as you can see here. The hormones travel through the hypothalamic axons, all right, which are derivatives of those clusters of neurons over here. And we already discussed what they were called. Superoptic nucleus for the antidiuretic and the paraventricular nucleus for the oxytocin. All right, so these two hormones will be transmitted down these neurons, down the axons, and tell the posterior pituitary gland to store these hormones and release them when needed. Okay, now let's talk about the function of these very important posterior pituitary hormones before we move on to anterior pituitary. All right, so the two found here are ADH, antidiuretic hormone, and oxytocin. Okay, this is how you spell it. Okay, and I'm going to see if I can spell out antidiuretic hormone here. Antidiuretic hormone. Well, it's the best I can do. Hormone. And what does this antidiuretic hormone do? Let's get into the details of this. The function of antidiuretic hormone is exactly the opposite. So for example, a water pill is a diuretic, right? It causes you to increase your urine output to pee out more water. Antidiuretic hormone gets into the bloodstream and eventually reaches the renal tubules, and the renal tubules will reabsorb the water and instead of increasing the urine output with more water, we're now reabsorbing the water back into the circulation, increasing the blood volume and increasing the blood pressure, preventing dehydration, and of course maintaining blood pressure. So yes, antidiuretic hormone is important. Antidiuretic hormone is suppressed, if you must know, from drinking lots of coffee as well as alcohol. Both of those chemicals will inhibit ADH. Okay, now let's move on to oxytocin. So oxytocin, like I said, stored and released in the posterior pituitary, made in the hypothalamus, is going to have three functions, not one. So these three functions, let's go over them. The three functions, number one, is it's going to increase uterine contractions, and it's one of the few hormones that actually does positive feedback in endocrine system. We always have negative feedback. We have enough of a hormone. That hormone level is up in the bloodstream, so the negative feedback will be either to the upper management pituitary gland or go all the way up to the hypothalamus to reduce production of either the releasing hormone or the production of a particular hormone in the anterior pituitary. But in this posterior pituitary, your oxytocin, the more oxytocin is released, the more continues, the hypothalamus continues to synthesize more, and of course the oxytocin is massively released by the posterior pituitary to cause uterine contractions and aid in labor and delivery of an infant. What else does it do? During this time, it increases the initial milk letdown, but is not by any means the maintenance of milk production. That has to do with the anterior pituitary, which we're going to go over in a minute. All right, what else did I want to say? The third component and function of the posterior pituitary is that it is going to increase, it's less popular function, people don't know about it, but it does increase bonding between mother and child, as well as there's been studies about it that increased oxytocin will increase the bonding between couples. All right, so, and even I've read about incidents where they have measured oxytocin levels with the amount of hugging. The more you hug, the more oxytocin is released. So that's an interesting little side note. So anyway, those are the functions of the two hormones released by the posterior pituitary but made in the hypothalamus. Okay, so we move on to the next topic, which is the anterior pituitary hormones influenced by the hypothalamus. So the anterior pituitary hormone, located anteriorly, has nothing to do with neural tissue. It is purely going to make, right, or synthesize the hormones and then release them. So it is not going to be controlled by the hypothalamus, other than the hypothalamus releasing these hormones that influence the anterior pituitary to release other hormones. All right, so I'm going to start now with right dead center, TRH, thyrotropin releasing hormone, TRH. TRH, thyrotropin releasing hormone, is going to stimulate the anterior pituitary to release TSH. You see the positive here. So TSH causes the release of thyroxine. So what is thyroxine? Thyroxine stimulates and regulates your metabolism. So kind of important to have, right? So there's thyroxine, all right? So that's TRH stimulates TSH. TSH goes into the bloodstream. These are blood vessels, so it's just demonstrating a visual to make you understand that the hypothalamus releases the releasing hormone, thyrotropin releasing hormone, which then influences via the bloodstream TSH to be released from the anterior pituitary, which then goes to the thyroid gland, and then the thyroid gland releases thyroxine, which regulates metabolism. Okay, I'm just going to put MET for sake of simplicity and keeping this video less than half an hour. Okay, the next hormone I'm going to go over is PRH. I'm going to go over the difficult ones first and the simplest ones last. I want to make sure that you understand the more complex ones. So here's the one that is released when someone is breastfeeding. So PRF, prolactin releasing factor, or the other term for it is prolactin releasing hormone. So you're going to see it both ways, these terms in various sources, PRF or PRH, it means the same thing. Prolactin releasing hormone is going to be released by the hypothalamus, stimulate, positive, right, stimulate, there it is, stimulate the anterior pituitary to release prolactin, which then goes to the mammary glands, which then releases milk. Now, as long as there is nursing involved and the baby continues to nurse, we have positive feedback where we're going to continuously stimulate prolactin releasing hormone to stimulate then in turn the anterior pituitary to release prolactin, and so on and so forth. However, once there's no more breastfeeding, then we've got negative feedback. Now, the negative feedback is we reduce the prolactin, or the levels drop off because we're releasing prolactin release inhibiting hormone. Say that 10 times. So it's PIH. It's basically inhibiting the production of prolactin. So that's number 2. So we went over TRH. We went over PRH. Okay. I'm trying to be organized here. Next one is GnRH. This is a complex one as well. Gonadotropin releasing hormone is going to influence not one, but 2 hormones. Okay, so what are these 2? luteinizing hormone and follicle stimulating hormone, LH and FSH. So LH has to do with hormones that are released by the sex glands. FSH has to do with stimulating the increased sperm production and ovulation. So LH is going to stimulate an ovary to increase estrogen production. LH in a male is going to stimulate the production of testosterone. Now, when we look at FSH, GnRH, gonadotropin releasing hormone, is also going to stimulate FSH, which stimulates the testes to increase sperm production. So I'm going to draw a little sperm here, right? And then we have the FSH stimulating ovary to ovulate, and here comes the egg once a month, day 14. Okay, so that's GnRH. Okay, so we did this one right here. So we did 1, we did 2, and this is the third one. Okay, now I'm going to go over the fourth one, which is also a little bit complex. Corticotropin releasing hormone, CRH. CRH is going to stimulate the anterior pituitary to release adrenocorticotropic hormone, which is going to further stimulate a distal gland that sits on top, superior to the kidney, and this gland is called the adrenal gland. And the adrenal gland has two parts to it, the outer cortex and the inner medulla. Well, we're not looking at the medulla because the ACTH, the adrenocorticotropic hormone, only influences the adrenal cortex. Okay, so what's in the adrenal cortex? We have mineralocorticoids and glucocorticoids, okay? So mineralocorticoids are a series of hormones. We have, for example, hormones that are going to increase hair growth. So these are androgens, but the main function is glucocorticoids, better known as the cortisol effect. When glucocorticoids are released, cortisol actually causes a state of hypoglycemia because the chronic state of stress, so if the hypothalamus detects stress, it's going to tell basically the anterior pituitary, hello, we have a lot of stress, chronic stress, ACTH must be released. And so then the adrenal cortex releases this glucocorticoid or the cortisol effect, which now is going to increase the glucose, hyperglycemia, increase the glucose in the blood, increase hyperlipidemia, increase cholesterol into the blood, causing plaque formation. So now with chronic stress, as you can see, and the cortisol effect, you can end up diabetic, hypertensive, and with heart disease. So these are due to chronic stress, these diseases. All right, so that's adrenocorticotropic hormone that is released directly as a stimulus from the hypothalamus, which releases corticotropin releasing hormone. And don't forget, aside, right, a little side note, besides the glucocorticoids, we have androgens, mineralocorticoids, also on this adrenal cortex. All right, so that was number 4. All right, and then we have the next one is growth hormone, and I'm going to go over these in detail. Growth hormone is a very simple one. It's basically growth hormone releasing hormone from the hypothalamus stimulates the anterior pituitary to release growth hormone, not just in puberty, but throughout your life to maintain and increase bone growth, muscle growth, and fat. Okay? Now I'm going to erase this hot mess over here so we can see a little bit more what we have here. And so a quick little review so that we understand everything that I've just discussed for the last 15 minutes. All right, so to top it off, we've discussed how many hormones do we have in the hypothalamus. Well, I want to say this. Before I say how many hormones we have, we need to show you this hormone right here, SS. That stands for somatostatin. I just told you that growth hormone is going to stimulate the growth of bone, muscle, and adipose tissue. If you have enough, we're going to have negative feedback. All right, this is negative feedback where somatostatin is going to be released by the hypothalamus to reduce the amount of growth hormone production and release from the anterior pituitary. There is another location of somatostatin. It's located in another endocrine gland called the pancreas, but that's for another day and another lesson. All right, so to conclude, how many hormones do we have in the hypothalamus? Well, we have 1, GHRH, 2, somatostatin, 3, PRF, okay, 4, PIH, 5, TRH, thyrotropin releasing hormone, 6, corticotropin releasing hormone, and 7, gonadotropin releasing hormone. So we have 7 hormones in the hypothalamus, and we have 6 hormones in the anterior pituitary. So we have growth hormone is 1, prolactin is 2, thyroid stimulating hormone is 3, adrenocorticotropic hormone is number 4, luteinizing hormone is number 5, and follicle stimulating hormone is number 6. And then posterior pituitary, what did we have? We had basically ADH and oxytocin. Okay, and I have one last slide, and I promise you I will let you go. Let me just write this out here. Oxytocin for sake of completion. I do hope you enjoyed this lesson. I hope it is complete for you and that I have good visuals. All right, so there's the nuclei with the neural tissue releasing ADH and oxytocin, and there is the connection with the bloodstream directly connecting the neural tissue and releasing. And what's happening is that the posterior pituitary is going to store, remember that, store the ADH and oxytocin. But then here, what do we have? The anterior pituitary gland. Okay, this is the posterior pituitary. And the anterior pituitary gland, this shows you a nice little example. ACTH, adrenocorticotropic hormone, stimulating the adrenal cortex, releasing glucocorticoids and androgens. Here's the thyroid stimulating hormone from the anterior pituitary. Now let me just elaborate on T3, T4. T3 is 3 iodines. T4 is 4 iodines. So the final product, thyroxine, which does influence metabolism, is T4, thyroxine, okay? So T4 is thyroxine, which, of course, regulates your metabolism. And then here you see FSH influencing the testes and influencing the ovaries. So LH is going to increase estrogen in the female and testosterone in the male. FSH will increase sperm production in the male, and FSH is going to increase ovulation, the egg, and that's pretty much everything you need to know about the endocrine system and the relationship between the hypothalamus and the pituitary gland, anterior and posterior. All right, see you next time for your next lesson. Take care. Bye.